Hey, welcome to the Explainer. Today we're going to crack open the medicine cabinet and take a look at a pill that, let's be honest, you probably think you know inside and out. But trust me on this one, there is so much more to the story.
Of course you have, right? It's got to be one of the most common drugs on the entire planet. But what if I told you that inside that one tiny white pill is this incredibly complex agent? One with a double life, a hidden history, and some pretty serious warnings. Let's dig in and uncover the truth behind this pill we all take for granted.
Okay, so if we're going to really understand aspirin, we have to start with its true identity. And it is not just a simple painkiller. No, this thing is a chemical powerhouse.
So let's meet the real deal. Acetylsalicylic acid, or ASA for short. And right away you can see it's got this split personality. On one hand, it's an NSAID. That's the same family as ibuprofen, the stuff you take to fight inflammation. But then, it's also an antiplatelet agent. And that's a completely different job, one that's all about how your blood works. 2 jobs, 1 pill. Wild, right?
So, the big question is, how can one chemical do so much? Well, think of your body kind of like a battleground. When you get injured or you're sick, all these signals start firing off, calling for reinforcements. Things like pain, fever, blood clots. Aspirin's mission? It's to go in there and intercept those signals before they can do their thing.
So here's the play-by-play. Aspirin hones in on 2 super important enzymes. They're called COX-1 and COX-2. And get this, it doesn't just, temporarily block them. Nope, it delivers a total knockout punch. It permanently shuts them down for the entire life of that cell. And that action is what stops the body from making the very chemicals that signal pain, fever, and clotting in the first place. So, what are these signals we're talking about? Well, think of the prostaglandins as your body's alarm system. They're the ones screaming, hey, there's pain here, or let's crank up the heat with the fever. And then you've got thromboxane A2. These guys are the emergency responders, the ones that rush to the scene to form blood clots. So what aspirin does is it basically goes in and cuts the wires to both the alarm system and the emergency dispatch. Pretty effective.
Okay, now this is where aspirin's story gets really, really cool. The amount of aspirin you take completely changes its job description. How is that possible? Well, it all comes down to the dose. So check this out. At a low daily dose, aspirin becomes the protector. Its main mission is to shut down those blood-clotting emergency responders. That's why it's so fundamental for preventing things like heart attacks and strokes. But you ramp up the dose, take a much higher amount, and it completely switches gears. It becomes the fighter. Now its focus is all about silencing those pain and inflammation alarm systems. It's just incredible. The key takeaway here for sure is that the dose dictates the destiny of the drug.
But, the saying, with great power comes great responsibility. And aspirin is absolutely no exception. It has a dark side, a kind of kryptonite that honestly everyone who even thinks about using it needs to be aware of.
Just look at this number. This single number represents one of the most important warnings in all of medicine. It's a number that every single parent needs to burn into their memory.
And here's why. If you give aspirin to a child under 12 who has a virus, something like the flu or even chickenpox, it can lead to something called Reye's syndrome. Now, it's rare, but it is incredibly serious. We're talking a potentially fatal condition that causes massive swelling in the brain and the liver. So let me be crystal clear. This is a non-negotiable rule. No aspirin for kids with a virus. Period.
And look, the warnings don't stop there. Remember how aspirin blocks those COX enzymes? Well, it turns out one of those enzymes also helps protect your stomach lining. So when you block it, especially with long-term use, you're opening the door for ulcers and bleeding. And for some folks with asthma, it can actually trigger a really severe attack. And of course, because it's so good at stopping blood clots, well, that makes it a huge risk before surgery. You absolutely have to stop taking it at least a week beforehand.
Another thing about aspirin, it really doesn't play well with others. If you combine it with another blood thinner, something like warfarin, your risk of a major bleed goes up dramatically. Mix it with steroids, the danger to your stomach just skyrockets. It can even mess with really important medications for everything from cancer to blood pressure. This is why you have to check with your doctor or pharmacist. It's essential.
Okay, so after hearing all that, you're probably wondering, how on earth do we use this powerful tool safely? Well, this is where we need to switch gears and think like a pharmacist. Their advice here is absolutely vital.
All right, so think of this as your 4-point user's manual. Number 1, never take aspirin on an empty stomach. Always have it with food to give your stomach a bit of a protective buffer. Number 2, if you're on it for the long haul, especially for heart protection, talk to your doctor about a second medicine just to protect your stomach. Number 3, if you're on that low protector dose for your heart, stick to it. Don't think more is better. Increasing it won't help more, and it could definitely cause harm. And finally, number 4, you got to be vigilant. Keep an eye out. Any weird, unexplained bruising or bleeding, that's your sign. Stop taking it and call your doctor right away. So, there you have it. The humble aspirin. It's a protector, it's a fighter, and yeah, it's a potential hazard all rolled into one tiny pill. It's a true chemical marvel, and it really demands our respect. So the next time you see that bottle sitting on your shelf, you'll know the incredibly complex and powerful story that's locked inside. So I have to ask, does this change how you see your own medicine cabinet?